And I hope you find it's a good source of information. It lets you feel like we're all in this together. I hope you feel confident about the changes we're making in order to lead Rhode Island through this. And I just want to continue to encourage you to keep yourselves informed, whether it is this press conference, if you want to sign up for the daily emails, reopeningri.com. Information really is power as we go through this. And that's going to be particularly true, even more so, actually, in the coming weeks and months as we begin the process of slowly and steadily reopening our economy. So I hope, thank you for tuning in. Thank you for all your cooperation. We are where we are because Rhode Islanders have stepped up and done the right thing at every step, and for that I am very grateful. Okay, we have a few things we have to get through today. First, we'll begin, as we always do, with the data up on the screen. Today, we're reporting another 122 new cases and, very sadly, another 16 deaths. And as we've talked about throughout this week, you know, every death is difficult. We're at nearly 700 now. They're concentrated in our nursing homes, and every one of those is a lost loved one. So I want to just make sure that we, the people of Rhode Island, continue to be sensitive, aware, and kind to one another, and recognizing that this is a very hard time for pretty much everybody, some harder than others, and it's on every one of us to go out of our way to be patient and kind to the people in our lives, because people are struggling, and we need to be there for one another. We have about 38,000 people have downloaded the Crush COVID RI app. That's not enough. We got off to a great start. We went from 0 to 10,000 in a day, and then to 20,000. 38,000 is excellent, but I wish we were higher. Let's try to get ourselves to 50,000. If you haven't downloaded the Crush COVID app yet, I don't know what you're waiting for. It's there, it's free, it's easy to use, it's helpful. Please take a minute, download it, and start to use it. There's different ways that you can use it. You can just use it to track symptoms and send the symptoms in to the Department of Health by your zip code. You could just get information on it. You could learn about where you could get a test, or you could use the contact locator, which I would encourage everybody to try to use. It will help us, but I'm asking you, let's make a big push this weekend. Find a minute. If you've done it, have your friends and family do it. If you're a teacher or someone who's in contact with, you know, lots of other people in your community, have them do it. Certainly, if you're going to be starting to get your kids back into youth sports, you're going to start to go back to church or synagogue this weekend, you're going to start to, you know, go back to the office, you absolutely better download that app, keep your contact tracing notebooks, and keep following the rules. Wearing your masks, not leaving your house without the mask, washing your hands, and certainly not going out if you're sick. It's really important. The rules matter now more than they did before when we were having our stay-at-home order. So let's get from 38,000 to 50,000 in the next week. It's doable, and I'd like to see us get there. Okay, so today the big announcement is that I am going to sign an executive order that allows us to officially begin phase 2 on Monday. A few weeks ago, now the first question is, how do you know we're ready? How do you know, Gov? And how will you know if we have to go back a stage? So a few weeks ago, I outlined the 4 data points that we would be watching closely as we track the trends of the virus. And these are the 4 measures, when taken together, not one, but when taken together, that tell us whether the virus is under control, is either continuing its downward trajectory or is under control, and therefore it would be safe to loosen the restrictions. So it was exactly 3 weeks ago that I lifted the stay-at-home order. And so that means we have had some time to change the way we do things, you know, start to go out to dinner again, start to go back to the office. We've done those changes, and we've had time to observe the effects of those changes. Fortunately, we're seeing good news. And I'd ask you put up a slide, please. I want to take you through, I want to be fully transparent. I've been fully transparent from day one, and I want to continue to be that way. I want to take you through where we are right now on each of those 4 metrics. So hopefully that's up on the screen. The first relates to hospitalizations. We said that we needed to see less than 70% of hospital beds filled with COVID patients. Today, we have less than half of that. We're below 30%. And in fact, really good news, hospitalizations have been on a steady decline for about a month. So that's exactly what we want to see. Hospitalizations going down and plenty of capacity in our hospitals. So we can check that box. Secondly, we said we needed to see consistently 30 or fewer new hospitalizations each day. We are seeing well below 30. In fact, most days we see new hospitalizations in the high teens to low 20s, so comfortably below 30. So we're going to go ahead and check that box. Third, we said we needed to see our rate of spread, sometimes called the R value, to be at 1.1 or lower. And we are there. We think we are now at about 0.7, so solidly below 1.1. Just as a reminder what that is and why it matters, that value is a measure of how quickly the infection is spreading. The simplest way to think about it is, what's the number of people that one infected person infects? So if I'm sick, am I spreading the virus to 1 person, 2 people, 3 people, 4 people? When we started this, well, a couple of months ago, the R value was about 4. That is a very bad place to be. That means for every person that's sick, they're spreading it to 4 other people. That's a scary place to be, because that means the virus is running away with itself, and too many people are quickly infecting each other, and you can see very quickly how that mushrooms. If you're under 1, that is a good place to be, because it means that each person is infecting less than 1 other person. Why is that happening? Because you're wearing your masks, you are staying 6 feet away from people, you are staying home when you are sick, you are working from home, if it's at all possible for you to work from home, and we've really limited our mobility. So in any event, that we get another check there since we're below 1.1. And then finally, we said we wanted to see hospitalizations doubling at a rate of every month or more. Fortunately, as I said, hospitalizations are declining, which means we're not seeing a doubling at all, and that is a great place to be also. A month and a half ago or 2 months ago, we were doubling hospitalizations once every 3 days. That is a very bad place to be. So we've gone from doubling once every 3 days to a decline. We've dropped by about 45% the number of folks in the hospital with COVID. It's all, within the context of this being generally terrible, this is all good news insofar as it means we've taken the right steps, we are in a much better, safer place, and we can move with confidence to phase 2. As we begin phase 2, which will begin on Monday, we are going to keep a very close eye on these 4 metrics. If at any point in the next few weeks we start to get into trouble on these metrics, then I'll have to make changes. As I said in the beginning, every piece of guidance I give is temporary. It's only as good as the data are, and if things change, then we have to change. And that's the way we're going to be living for a while. So now I don't expect that to happen, because I expect everybody to follow the rules. But here's what we know. The more we're still learning about the virus, what we know is large crowds are just terrible. That they call that this. There's certain environments where there's super spreaders. Big crowds, big congregations, parties, concerts, events, crowding in a restaurant, crowding in a supermarket, crowding anywhere is a serious problem. So I'm counting on you to please do your best to social distance, follow the rules, and stay out of crowded places. If you find yourself in a crowded place, please get out of that place. And that means an elevator, that means a party, that means a backyard barbecue, that means a gym, that means a karate studio, that means a dugout. I mean, anywhere. If you find yourself in a crowd, I want you to get out of that crowd. You're doing something wrong, and you're putting this whole thing at risk. But if you keep following the rules, I think we'll be able to get to phase 3 in about a month after we start phase 2. So you can think about it roughly as June 1st and then July 1st for phase 3 to begin. But as I said, that's all subject to change, because if in a week or two we start to see hospitalizations ramping or they are not ramping, then I'll have to make changes. I am excited about phase 2. I'm excited that we're going to see some reopening in nearly every area of our economy. Hairdressers, barbers, nail salons, indoor dining up to 50% at restaurants, gyms, outdoor recreation, youth sports, malls. It's a very big step forward. And so, you know, I'm looking forward to it. I think we're ready, and I think it's going to be good. You need to know, though, it's going to be different. So just maybe take the weekend to really internalize that. It might not be as fun as it used to be to go get your hair cut. If you go to the gym, it's gonna be different. You can't use the locker room. You should wear your mask. You should limit your time there. But I'm asking you to just go along with the rules for another month so that we can get to phase 3. This past week, the Commerce team, in conjunction with the Department of Health, held 4 Facebook town halls to walk folks through the guidelines to answer questions. I want to thank the thousands of Rhode Islanders who participated on those town halls, actually tens of thousands of Rhode Islanders, if you add it all up, who participated and gave us your feedback. You had a huge impact on the way we put these regulations together, so thank you so much for your help. In the process of doing those town halls and doing our conference calls and our Zoom calls and touching in with our advisors, we often get the question, what if we're not ready? You know, certain faith leaders have said, we're not ready. Or a lot of hairdressers have said, what if I'm not ready for June 1st? The answer is, if you're not comfortable, then wait. If you'd feel better waiting, then you should wait. This is new. It's still better to go slow. If you need to take another week or 2, that is fine. It is so much better to be safe than sorry. So I don't want anyone to feel pushed into this. Also, you know your community's best. You know your faith community. You know your regional community. We still have certain communities, Central Falls, Pawtucket, Woonsocket, areas of Providence, where our test positive rate is too high. We want to be below 10%. They're still at 20%. So in those communities, you do what you think is right to protect the people you interact with. And if you're not ready on Monday, a few people have said to me, Governor, we don't want to kind of disobey the rules. We don't feel ready. That is fine. Take it at your own pace. And most definitely, take the time you need to get your place of worship or your office or your barbershop ready to comply with the new rules. Now, for those of you who are ready to get going on Monday, I would encourage you to visit reopeningri.com. After a lot of work, we finally got everything up there. So you can review the Phase 2 general business guidelines and the guidance documents. There are very detailed guidance documents by sector for restaurants, for hair salons, for nail salons, for barber shops, for gyms. The team did a really great job of trying to provide as much guidance as we can. If you're still confused after reading that, call us. Call 521-HELP. Call the governor's office, call Commerce. We want to give you a hand to get through it. A few other really important things. Make sure, do not open Monday if you haven't completed your COVID-19 control plan. There's a template that you can follow for that control plan on the Reopening RI website. Do not open Monday unless you have a completed COVID-19 control plan. We're going to begin ratcheting up the volume of our business inspections, and if we show up and ask you for your COVID-19 plan and you don't have one, there will be consequences. So go online, download the template, and make sure you can check all the boxes. If you missed the Facebook Lives or you want a refresher, all the videos for those Facebook Lives are available at the Rhode Island Commerce Facebook page. You could check them out. And as a reminder, if you're a small business who's looking for masks or cleaning solutions, Commerce is making those available through industry associations and local chambers of commerce, so you can visit commerceri.com. I know now it's getting real. Monday's around the corner, and we're hearing from people, how do I get the masks? How do I get the cleaning supplies? What do I do? A little bit of not panic, but folks are scurrying around. We're here to help you. We have supplies. We want to help you out. So go to commerceri.com, and if you're in a pinch, we can get you off to a good start. So that's what life will start to be like on Monday. This weekend, starting tomorrow, places of worship are open up to 25% capacity with very strict limitations. And if you're ready to do that, fine. I would just say, if you are older, if you are sick, it is your choice, but you might want to think about continuing to observe remotely. I won't make that decision for you. The churches and synagogues and mosques will be open, but if you're an older Rhode Islander or a sick Rhode Islander or have an underlying health condition, you just might want to think twice before going in person to services this weekend. Okay, 2 more notes, please. I want to address visitation to nursing homes and assisted living settings in Phase 2. And before I do that, I want to recognize again, as I have often done, how hard it has been for people who have loved ones in nursing homes not to visit with them. We get a lot of letters and emails from people saying, I haven't seen my mother, grandmother, aunt, uncle, husband, wife in over 2 months, and it's devastating. And I don't discount that at all. I know it's real, and I wish we could do something differently. The truth of the matter is, we continue to struggle to get a handle on this virus in nursing homes and assisted living centers, in these communal living situations where it is difficult to keep people safe. So in light of that fact, and in light of the fact that it's still very much a crisis in nursing homes, we unfortunately will not be relaxing visitation restrictions on nursing homes and assisted living centers during Phase 2. I know that's tough. I wish it weren't the case. It took a lot of discussion. We all wish it could be different, but right now it can't. So no visitation is allowed in nursing homes or senior living centers in Phase 2. I hope that will be able to change in Phase 3, and I hope that we can look forward to July, where you can, in a safe way, visit your loved ones in these settings. We are working collaboratively with hospitals to develop plans to allow for visitation. They are still working through their plans. I think most hospitals in phase 2 are going to make some accommodation for end-of-life visitation, but they are not going to be really expanding their visitation until phase 3 either, and each hospital is going to handle that a little bit differently. I can hear many people now saying, come on, is this necessary? The answer is it is. It is. We got to keep your loved ones safe in these settings. These settings are very difficult. We also have to keep the people who work there every day safe. Healthcare workers have really shouldered the load for the past 3 months, every day, living with stress, anxiety, and risk. And so we need to keep them and their families in mind too, which is why we're coming down with a pretty strict set of guidance on this. We are going to be relaxing visitation for other congregate care settings, such as DCYF group homes, DCYF visitation, the ACI, and other congregate care settings or communal living settings where the population isn't sick and frail. Those specific guidelines will be on reopening RI today by the end of the day. But chances are, if it's a communal setting where the people in that setting are not very sick or elderly, you will be able to resume visitation under new strict restrictions: mask wearing, limited in time, social distancing. Finally, yesterday I was asked a question about when we'll be reopening the casinos. As I said yesterday, we've been working very closely with Twin River. I want to publicly thank the team at Twin River for their collaboration. I want everyone to know the folks at Twin River are 100% committed to your safety. You are seeing some other casinos in California and Connecticut. They're opening with gusto next week. Twin River is not taking that approach. They decided to reopen on June 8th, so a week from Monday, in a very limited way, by invitation only, no table games, extreme social distancing, mask wearing, extra precaution with sanitization stations all around the facility, deep cleaning, and they've even, I think they're going to be closing or removing certain of the VLTs to enforce social distancing. I applaud them for that. I think that's the right way to do it. So starting June 8th, if you're invited and you feel safe and you want to go to Twin River, go for it, follow the rules, have fun. And over time, it'll reopen more. It will reopen gradually. But the team at Twin River has said it's better to have a limited, slow, and safe opening than it is to do too much too fast. They're right, and I give them credit for doing it. And the restaurants in Twin River will be subject to the same exact restrictions and guidelines as the rest of the restaurants in Rhode Island. So they will be opening their restaurants, but under the same restrictions as the other restaurants in the state.